Hi, I'm Bill Santamore, Managing Editor of Hospitals and Health Networks magazine. Welcome to our December preview edition of H&HN Daily. I'm here with my colleagues Hayden Bush and Matthew Weinstock, and we're talking about the issue that you wrote the cover story for, Hayden.
I did. It's about the experiences hospitals are going through as they prepare next year for some pretty significant changes to Medicare's value-based purchasing program. And specifically, 30% of the reimbursement for that program will be through HCAHPS patient satisfaction scores. What I found is hospitals kind of have a kind of two-pronged approach as they prepare next year. They're going through question by question and trying to come up with strategies like nurse rounding and pain management that they think will improve their standing on individual questions. But then a lot of hospitals are also taking a look at big picture kind of cultural strategies that they think will improve the patient experience, whether it's leadership or patient or employee engagement, or even looking for people with the right people skills to really play a part in their organizations.
Hayden, did it surprise you that there was such an emphasis on employee and cultural competency within the hospital? Because when we first talked about this story, we were so focused on HCAHPS and its relationship to reimbursement.
It did, and what I found out was that a lot of hospitals are looking at HCAHPS as just one part of this broader cultural strategy. So I found Aurora Healthcare in Wisconsin, they have a strategy and a dashboard where they go through every question and they try to address what they're going to do. But then they're also asking their employees to take a pledge to be courteous and kind and respectful to each other. And another hospital I found, Henry County Hospital in Napoleon, Ohio, is asking employees to thank each other and give each other praise for a job well done. So they're really using HCAHPS as just one piece of a larger cultural strategy to improve their institutions.
Now, Matthew, could you tell us something about the clinical management story that we run? This is a series we run every other month, looking at a specific area of the hospital or issue related to the hospital. And this one is called the Silver Stampede.
Right, so this one's all about geriatrics and whether or not hospitals are prepared for the influx of elderly patients that will be coming over the next few decades. And by 2050, the number of people in the population that are 65 years or older is going to double to 90 million. Those who are 85 years and older will triple to 19 million. So the question is whether hospitals and health systems are prepared for that. And in most cases, the answer is no, that we don't really train clinicians to look at geriatrics the way that this patient population is really going to require.
And that's also going to make them take a look at reevaluating their service lines, I expect.
Right, they're going to have to reevaluate their service lines. They're going to have to come up with better relationships with their post-acute partners so that when a patient is transferred to a post-acute facility, that facility adheres to the same quality measures, because you don't want that patient coming back on a readmission. It also means internally that you need to train more clinicians in geriatric care.
Right. Okay, and another feature we have this month is about the shortage of specialty physicians in certain parts of the country. We've written a lot about the shortage of primary care physicians all over, and that's going to be an issue as we move toward the medical home model. But certain areas of the country are having trouble recruiting specialists like orthopedic surgeons and pediatricians, and et cetera. And there's a lot of reasons for that. One is that younger physicians want to improve their lifestyle. They don't want to take on call, et cetera. There's also the issue of specialists becoming more specialized. For instance, an orthopedic surgeon might just do hand surgery.
One of the other things, Bill, I thought was interesting in the story is there's a contrary view, right, that some people think there may not actually be a shortage, but it's a different problem.
There might be enough specialists, but they're just not distributed around the country properly. They tend to congregate in metropolitan areas or other areas with high physician levels, and that leaves other regions of the country with a shortage.
Right. Well, Bill, Hayden, thanks for talking to me about the December issue. And thanks to all you for tuning in, and happy holidays from those of us at H&HN.